the research in my lab, which is the biomedical imaging lab, focuses mainly on biomedical imaging. So we do a variety of different research projects. They're all driven primarily by medical questions that are of interest to our clinical collaborators. So for example, one main focus of our lab right now is chronic neck pain. So we have a funded project that's going on right now trying to understand mechanisms of chronic neck pain. In particular, something called myofascial trigger points, which play a very important role in myofascial pain syndrome, which is a class of very common yet poorly understood neck pain syndrome. So what we are trying to do is understand how the properties of muscles in the neck, for example, the upper trapezius muscle, get altered in terms of their biomechanical properties in patients with chronic neck pain syndromes. And we are trying to understand how different treatments might impact the milieu of the muscle, the properties of the muscle, and how those changes correlate with the clinical outcome of the patient. So several things that we try to do are use ultrasound imaging to look at the biomechanical properties of the neck muscles. In particular, we're looking for things called trigger points, which are these palpable knots in the muscle that you can feel during palpation, and then they have been associated with neck pain, and they actually cause referred neck pain. So a common treatment for these neck pain syndromes is what's called dry needling. So a physiatrist would take a acupuncture needle and actually perturb these trigger points and perturb the muscle to induce a twitch response. And it has been shown that it has some improvement in syndrome, in the symptoms of the patient. We are trying to understand what exactly might be going on in the muscle before treatment and also after treatment in terms of the biomechanical properties, in terms of the biochemical milieu of the muscle, and so forth. So that's one main focus of research in the lab. So clearly it impacts the community because neck pain is one of the most common causes for hospital visits. It's very prevalent and it has a significant impact in terms of healthcare costs.
Is it related to back pain too?
It could potentially be extended to back pain as well. Chronic pain is a very complex problem, so we are trying to attack a very small subset of these chronic pain symptoms. But so we are starting with neck pain because that's one of the more common forms of myofascial pain. But yes, it could extend to back pain as well.
Okay.
So that's one aspect of our research. There are other aspects. We are also interested in cardiovascular disease and stroke. So there's a project going on right now in collaboration with the Veterans Affairs Hospital and University of Maryland, where we are trying to understand how blockages in the carotid arteries may rupture and cause stroke. So we're trying to understand underlying mechanisms, what causes these blockages to become more vulnerable to rupture, and so forth.